thanks so much for coming on the show.
Thanks for having me.
It's great to have you here.
Thank you. Thank you very much.
Dr. Lipov, do you have any crazy or weird stories of your many years of being a doctor or even working in the ER?
I have a lot of stories. It's one thing having done 40 years of clinical medicine, which is older than any of you guys probably. So I'll try not to get too morbid, but at one point I had the privilege to run a trauma unit in Cook County Hospital.
Wow.
Which is pretty rough. It used to be called the Knife and Gun Club. So people get
Ooh,
shot.
that's not good.
Definitely not a good thing. So actually two cases come to mind. One of them, this young man was shot through the brain, and so he died in the ventilator, basically. So at that point...
You said you weren't going to go morbid right off the bat.
I have much more morbid stories.
Uh-oh.
This is light compared to morbid.
All right.
Well, we could always take it away. Anyway, so the worst part was, so we wanted to use his organs to save other people's lives, so the nation. So my lovely job was to go out to the family and tell them, your loved one just died, do you mind if we use their organs?
Ooh.
So I had people kept fainting all the time. So I had a bag of, ammonia capsules, so I could revive them.
Oh, so this was a repeated thing.
Oh, yeah.
You're going out, facing the family,
like,
they're fainting.
Do you mind if you take your kidneys? Your child just died. Usually young man.
Wow. That's honestly rough.
Yeah, pretty nasty.
Yeah.
The other story was we had this patient, he was a truck driver, and truck driver fell on him.
Ooh.
So they brought him and his legs separately.
Uh-oh.
And he was soaked in gasoline. So we were afraid of exploding him as we were operating on him. Of course, he died.
Wow, crazy.
There you go.
Happy story. Now you know why you are who you are.
Yeah.
Well, so I was happy. It's a great place to be from. I think it made me a much better physician. But one thing I did learn is life is precious. Live your life to the fullest every moment, because who knows what happens.
Yeah, that fragility of life. I'm sure, because you're facing it day in and day out.
But
I'm sure you saw some weird stuff.
Yeah, some of it was a little too detailed and too graphic.
Okay.
Yeah.
All right.
So I'm trying to keep it.
PG.
I kind of want to hear those.
Definitely not
PG. Those are the good stories.
I'll tell you one kind of cute, funny story.
Okay, we'll take cute.
So let's go funny. So we had this person in the unit. Usually we don't have visitors, because the people literally come off the street, go to the emergency room, you go up to the trauma unit, and that's when you operate on them. And we have to go operate, whatever, save their lives. So there was a small little cubby hole. We would keep people there. So we had this one patient we were keeping there for observation. So this person was dressed as a woman, and then another woman came by and say hello, whatever. So 6 hours later, the same person came back dressed as a man.
Oh,
and
interesting.
I don't know who was he, they, I don't know. I wasn't quite clear.
You never know these
days.
So
I'm working on this person, and he was trying to bleed to death. So, I got it under control. So the nurse come by, they go, I think they're doing something in the back there. Go deal with that.
Oh.
So I came by, and of course they were doing something that was not really appropriate to be in the middle of trauma unit. He certainly wasn't that sick to be there. So I had the great privilege to tell him to knock it off and get the hell out of the unit.
Oh boy!
All right.
But what made the story interesting was that that person kept changing the gender of the clothes.
Yeah. That's the part that makes it weird.
Yeah, I was so confused. I was like, I don't care who you are, where you put what, but get out of the unit.
Don't do it
I don't know if you're a guy or you're a girl or who you are, but
get a room, literally.
That can be happening.
Get a room on your own time.
So is that a weird story?
That's a very weird story.
There you go. There's a weird story.
Okay, so my question for you is, if you could master any type of skill that is not related to medicine, what would it be? Instantly master.
I would love to be able to draw.
To draw?
Yeah.
Oh.
I have amazing imagination, but drawing capabilities, the only thing I'm really getting into it now, but I'm using ChatGPT to do it.
Really?
So it's pretty funny. I wanted to combine, we have a house in San Miguel, Mexico. So I wanted to combine a famous church there with Starry Nights by Van Gogh. So ChatGPT does, I guess, the ChatGPT that tells me this now, they go, that's a very interesting mixture. This is ChatGPT analysis.
Kind of like our sculptures.
Yeah, exactly.
Points for originality. For
When
sure.
next time we get together, hopefully we'll have an appropriate sculpture.
Absolutely.
Each.
Absolutely.
The three amigos.
I can see it. The
Yeah,
artiste.
you guys, this sculpture that Dr. Lipov is making of Lauren and I, we are the three banditos.
Oh, yes.
And they are spinning images of what we
us.
look like, but we are mermaid banditos.
Exactly.
That's what is really impressive
Exactly.
about it.
With the belts.
It's very
you know,
original.
Yes.
And definitely original.
It's very original.
Nothing like it.
Not, maybe you can put in the pictures that I send you of starting that your head's done.
Oh,
You can put it in.
We will put these photos on the podcast
I think
for
it's
everybody
hilarious.
to see. They're
Put some
hilarious.
images in. Yeah.
They're hilarious.
That's our first merch for the podcast.
And that, I don't know if that. But we are going to have, each one of us will have a set of three, right? Each one will have an individual one.
Yep.
So I think every time you look at it, especially when you have a bad day, you look at it, you cannot help
At
but
least we'll
smile.
have a smile on our face.
Exactly.
That's for sure.
So it makes it fun.
So if you weren't a doctor today,
I think I seem what I am, but okay.
If you weren't, if you
Oh,
chose
if I was
another
not.
career
If I was
path,
not.
what would it be?
That's easy. When I was in college, I had a choice going into biochemistry or genetics or medicine.
How about non-science?
Non-science.
Non-science or medicine related? What might you have been?
Well, if I was a good painter, I'd become a
Back to the
painter.
artiste.
Yeah,
But
the
I
artist.
can't do it at all.
Back to the
Yeah.
artiste. Well,
Exactly.
The artist.
I don't
think
know.
he wants to be an
If
artist.
I wasn't science, I'm very science oriented. Certainly,
Yeah.
I've been a slug.
I'm the same way.
Yeah, so I'm not very athletic, so I couldn't be a professional athlete. I can barely speak. I mean, certainly my writing is terrible. Getting better after
The
67
doctor or
publications.
artiste?
Dr. Artiste, I don't know.
Dr. Artiste.
I'm not sure I would have much of a future
Well,
in whatever that would
I don't
be.
know.
I don't know. You have to see these sculptures. They're pretty good.
I think sculptures are great. Well, I can conceive a lot of things, but I have to tell people to carry it out. So if I have the people to do it, so now I actually, with
You need
ChatGPT,
minions, is what you're saying.
I need minions.
You need
Yeah.
like an army of
I
minions,
did minions,
to
yeah.
do your bidding. Okay.
Yes, I did minions. But it's funny. So I got the ChatGPT, I printed it out on canvas, and then I put glue on it and I can draw on it. So I got like 4 of them. So there are 4 of those original paintings, my original signature.
Original painting.
Yes.
Ooh.
Great.
And San Miguel. So one of the women that I met was an artist, and she goes, "That's not art. What are you talking about? That's just computer." I said,
Art
"No,
is in
it's
the eye
a
of the
mixed
beholder."
art." She did not go for that.
You didn't get her gut.
So, last rapid fire question. If your life had a warning label, what would it be?
Warning label.
Yeah, what would it say?
Well, listen to his trauma history with caution. It may activate your trauma.
It might activate your trauma.
I've had a lot of it as I've thought about
Caution.
it. Caution, exactly.
Caution.
Caution. Trauma ahead of you.
I think you have a great sense of humor. I would
Yeah,
say something
sure.
about that as well. One thing that I really admire about you is you work with a lot of people who've experienced a ton of trauma in their life. You worked with people who are at the edge of suicide, and you're able to bring a lightness to a lot of these
you.
situations. You're able to bring a lot of humor. I've seen you be very serious and serve these people in an incredible capacity, but also mixed with this lightness that I think is very much needed in the healing space.
Well, thank you. I think it's important. I do try to teach it to like my residents or fellows. I think it's crucial because what it does, it keeps the patients calm, and it makes it, frankly, much more fun. I'll give you an example of that. It's kind of cute. So I have to tell you this story. So we treated a child recently. So I've been very interested in PTSD in children. So this guy, when he was 10, his mother brought him over. He kept running around and hiding in all the drawers. So I had to send him home because I said, I'm not going to catch him and drag him, right? Comes in 3 years later. And typically we put children to sleep when we do the procedures. He comes in, he said, I don't want any anesthetic. I don't want anything. I don't want this. I don't want that. I just do the procedure. So this is 13 years old, which is not typical. So I started kind of joking around with him. So I put a big dot on his nose was a marker. So why did you do it? I said, because I felt like it. So he laughed. So we did the procedure. He did great. So his mother actually called us recently and she said, before he was fighting and he was angry, now he's relaxed and calm. This has been like a month since the procedure. So we're going to write a paper about him.
I love it.
But isn't that hilarious?
Amazing.
So he came in the next day. I said, do you want another dot in the nose? He said, no, I do not. I said, okay, fine. If you want to do it, then.
Yeah, you play. You bring in a level of play, which I think is incredibly healing also for the nervous system for these people who are in a very serious state in their own physical health. And if you think about a lot of different medical offices and hospitals, it's very sterile, it's very cold, and there's no play. So it's been really cool to be able to witness you bring play and lightness and even get to experience the procedure myself. I felt so welcomed.
Thank you. I appreciate that.
Look, I get it. You are burnt out with today's healthcare systems and options that are being offered. Maybe you've gone the conventional medicine route and you've gotten basic lab testing done and everything came back as normal, but you still felt like something was truly wrong in your body and you still struggled to get better. This is why I'm so passionate about what we do at Rachel Shear Nutrition. We are not like a lot of the other functional medicine practices that are out there. We are not a one-size-fits-all program. The system that we developed was actually what I wish that I had when I was struggling with my own health issues, when I was on 5+ medications and I was being told that I needed to have my entire large intestine removed. I saw firsthand what it truly takes to heal. And it's not just extensive labs. Yes, those are important, but truly identifying why we have these problems in the first place, which means we want to get to know you. We want to get to know your lifestyle, your diet, your trauma history, the things that you walked through. We also bring in something called psychophysiology, which is the mind-body connection. And this is what it really means to have a holistic approach when it comes to healing. So if you're sick and tired of the conventional what approach without truly healing, and you're sick and tired of working with functional practitioners or just giving you cookie cutter plans, and you want to learn more about the RSN approach, you can book a free call by visiting rachelshear.com.
So speaking of this procedure, let's talk about that for a minute. This is what Playboy once called the God shot. More.
That was a quote from a Marine, actually. So some of the Marines used to call it the God shot because it changes lives.
Tell us about it.
So stellate ganglion block, or basically it's a procedure where you numb up the nerves in the neck, which control the fight and flight nerves that go from the neck to the brain. Simple as that. So the first time it was done was 1926 in France. And we used to do it blind. Like first time I did it was 1987. So basically you go, it's called superficial anatomy. It's a euphemism for palpating around and you hope you hit the right spot. Then I did about 30 years of doing it. It was X-ray. Now we use ultrasound so we can see where the targets are. So in order to kind of understand how that works for PTSD, post-traumatic stress disorder, a term that should be changed, maybe we can talk about that. But what happens when somebody has trauma? So the brain produces something called NGF, which is nerve growth factor. It produces norepinephrine, which is fight and flight transmitter, and at the same time produce NGF. So once the norepinephrine gets in the brain, then people feel anxious, disturbed, they have fast heartbeat, they can't sleep, all of that. So if you think about it, if you stand in front of the bus, about to get hit, jump out of the way, hopefully, then those are the symptoms. But when the NGF goes from the brain to this ganglia or collection of nerves in the neck, it makes the nerves in the brain, called sympathetic nerves, grow extra. So instead of, let's say, 5, now you got 10. Each one of those nerves produces norepinephrine, but it gets stuck like that, stuck in a non-scientific way. But scientifically, it's called, it's basically extra growth of the nerves, right? So it's sprouting. So when you have that, and they can persist for years. So we've treated, for example, I treated somebody successfully who was involved in Vietnam battle 40 years ago. And he's did great. So turns out when we do a local anesthetic injection in a neck, it does a couple of things. It does one thing, norepinephrine goes down immediately, but local anesthetic lasts 8 hours. So the question has been for a long time, why would local anesthetic that lasts 8 hours work for 20 years? For example, the longest outlier right now that I've treated was 20 years out. So why would that happen? So it turns out in order to maintain the sprouting of extra nerves, the 10 nerves, you need NGF here in the ganglion. So when you put local anesthetic on the ganglion, it takes away the NGF. So think of NGF like fertilizer. So if you take the fertilizer away, the leaves fall off. So the same thing happens in the brain. It's called pruning. So the extra nerves that you don't need go away. So now you do baseline. So people a lot of times will feel markedly better right after 5-10 minutes, but it can last for months or years.
When I had the procedure done, it was really interesting because I think it was you that asked me how I felt, and I was just so exhausted and tired after the procedure. And you said, well, I didn't give you anything to make you tired or sleepy. And so can you explain that a little bit? What is happening when we actually temporarily numb the fight or flight response in the body?
Yeah, so the easiest way to think about it is if you're walking around with PTSD or something like that, your gas pedal is always on. It's compressed. So you learn how to keep yourself as calm as you can. But your engine is working. You're not on 1,000 RPM. You're 8,000 RPM. So you're always revving. You're revving. You figure out how to control it, but you're still working at it. So if now, when you do the block, you take the pedal off, even if I gave you no sedation, people are going, I'm so sleepy, I'm tired. Why? Because the engine now doesn't have to work as hard. So all the compensating mechanisms that were in play are like, the brake is now dominant because you took off the pedal, right? So for example, one of my buddies did a stellar ganglion block on a guy who was like pretty severe PTSD from special forces, things like that. Anyway, so he fell asleep the next day, driving, got in a big car accident. Because they took the pedal of the gas off, but all the drugs he was taking was still compressing the brake.
Because of the drugs.
So he got sleepy, right? And your adrenal has been working overtime, and all the other body's been running too fast. It's not good for the engine to go at 8,000 RPMs continuously. Hard to sleep.
Is it safe to say that the SGB is a root cause approach for trauma and PTSD in a lot of ways, where we're actually getting to what's happening in the nervous system when trauma and PTSD occurs and undoing a lot of those nerves that have been created in those pathways?
I think it's a fair thing to say. So if you look at PTSD biologically, it's not without any other additions to that. So biologically, the amygdala, which is the part of the brain that controls anxiety and PTSD, is revved up. You can see it on brain scans. And then if you take the fluid around the brain, which is the most accurate way to measure transmitters in the brain, it's called CSF, cerebrospinal fluid, and measure norepinephrine. So norepinephrine in people with PTSD will be twice as high as people who don't have it. So we know that's all true. So if you can reduce a norepinephrine level and reduce the activation of the amygdala, you're not going to have the symptoms. So that's what happens after norepinephrine, after stellate. So a buddy of mine, Dr. Alkire, who is a professor in Irvine University, he did a study using PET scan, which is an advanced scan, and he showed that the amygdala is deactivated or calms down after stellate. So I think that's as root cause as you can get. Because you're not taking medication to cover anything up. So if you can reduce the sympathetic system, so now you can be calm. So if you have thoughts which are disturbing, what we're finding after the block, people can be markedly more compliant with psychotherapy because it doesn't rev them up, right? And then some people actually get memory back, emotional memory. So this actually brings me to my other favorite comment, that there are two memories. So one of the things I wanted to actually write a book with you someday, tale of two memories instead of tale of two cities, right? So there was a great study done in Philadelphia where they had patients that had hippocampal infarcts. Hippocampus controls short-term memory. So if this person meets the same person every 2 hours, they won't remember who they are. They keep meeting new people all the time, even though it's the same person. It's kind of sad. Anyway, so they showed them sad movies and then asked them 2 hours later, how do you feel? Sad. Why? No idea. Because the amygdala has an emotional memory. Hippocampus has a specific memory, right? It's different. So then the next day, they showed them happy movies. They asked them 2 hours, how do you feel? Happy. Why? No idea. And then what we are finding is, especially with the left side, I don't know if you've had that for you, but a lot of times, left side, people get access to their emotional memories from childhood, which could be overwhelming.
Day, I think that that's I experienced. Yeah, the second day is where I had a bit of an emotional release when I did it.
Right. But a lot of times people go, I kind of remember that, but now I really remember it. And then you can process it because you have access to it. Because you can't process something that's just out of the eye, right? You see something here, but you don't really see it. If it goes in front of you, you go, oh, I know what I'm doing with, right? So you can process that then.
What are some of the comments you've heard, like when people are first experiencing some relief, let's say in the first few minutes or in the weeks and months after? What are a few things that you get to hear? Because I'm sure that's the most rewarding part of your job, is feeling like you're giving quality of life back to people.
Well, I truly feel like every time people have a good result, which is thankfully most of the time, I feel like my mother's giving me a pat in the back saying, nice job, doing something good with some bad stuff you've had to deal with. So one of the big ones that people go, I can take a deep breath. I have not been able to take a breath forever. We can talk about why that happens. That's crazy. The other one is, people start to smile. Like I had one guy, special forces guy, calls me up 2 weeks later. He said, I had a really big problem from the injection. I said, what do you mean? My face hurts like a mother. I have not been smiling in 50 years. Now it's like, I feel like I'm grinning like a fool.
Wow.
Like, not the worst thing. He said, you're right, Doc, fine. It's okay. And I think one of the best things is, considering I'm very sensitive to secondary PTSD because my mother had it. And when I've treated this guy from Puerto Rico, actually, he told me that his wife actually told me, he said the temperature in the house went down a number of degrees. So now it's calm. We have a young daughter. It's so much easier to deal with my husband. It wasn't his fault. It's biology, right? So when people go, well, you're too weak or you're not trying hard enough, blah, 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 blah. That's just blaming and shaming, which just doesn't help anything. So to me, I think that's because I was one of those kids. Living in that type of household is a pain in the ass. Do not recommend it for fun, that's for sure.
So Lauren, I'm so excited to have you a part of Rachel Shear Nutrition, but what are some of the reasons why you wanted to join the Rachel Shear Nutrition team?
When I looked at the projections of where functional medicine is expected to go over the next few years, it's going to skyrocket, as well as telemedicine. So when I got to see, hey, this is an opportunity not just to be on the forefront of a conversation about the paradigm of healthcare changing in our nation today, but also a movement to equip those leaders who will lead the way. That's an incredibly exciting thing. So I'm excited to see what's ahead because, honestly, we're just getting started.
I know, we're just getting started. Yeah. And it's so exciting to see how functional nutrition and functional medicine truly is the healthcare of the future. And I am so excited to see the amount of health coaches and dietitians, nurse practitioners, and nurses who are wanting to get into this field, who are wanting to truly really make an impact. They're sick and tired of having only 15 minutes with clients who really don't actually want their advice, and to be able to also create the freedom that they truly want in their life as well, to create the impact and the income. So if you guys are listening to this and you want to learn more about how you can get in on functional nutrition and become certified with your background as a health coach or a practitioner, you can head over to rachelshare.com/certification and you can learn more about our certification process.
Big things ahead.
Big things ahead.
Will you tell us a little bit about your childhood, where you were born, where you grew up?
I call it spunky. When I ask people, it's like, did you have an easy childhood or was it spunky? 90% of the people I meet, I have spunky
I think
childhood.
we've all had spunky
I had a
childhood.
spunky childhood.
Yeah. I mean, some people have just amazing childhood.
I think that's why we're all in this work that we do
Yeah.
together with
You know what I
Levi.
find? People who've been through a lot are the best achievers, actually. So if you look at most special forces guys, to me, like that's the extreme of amazing. 90% of them had spunky childhood.
Yeah.
In order to get through all the craziness, and it's like, in order to get where I've gotten, I spent a lot of time reading, and it's like nobody was telling me to do it because I was just, I wanted to be able to figure out how it works and help a lot of people. And, thank God, and we're able to do some amazing things. And here we sit today. As far as my childhood, I was born in Ukraine, in Cherkasy. So it was a site of World War II tank battle. So the reason it's relevant is because when I was, I think, 4, something like that. So we were hanging out with some boys, and they found this, looks like a, rusted pipe. So we took it to my dad, and he said, get away from that because it's an unexploded tank shell, anti-personnel tank shell. I was like, not a good thing. So anyway, so he hides it, and those geniuses found it. They found it, dug it up, and they went to go play with it. So threw it against like a big oak. Nothing happened. Then they threw it against a piece of, like a stone, and something happened. It went off. So one guy lost 2 legs, and these are like 10-year-old, 12-year-old children. Another one lost an arm. There's an investigation, all of that drama.
Wow.
So that was entertaining.
How old are you at this point?
5, probably. Yeah, about 5. So then from there, we went to Moscow, and I lived in Moscow from 6 to 14. I came here. Not the best time to change environments when you're kind of fat, poor, and stupid. That was not my, that adolescent phase was not particularly good. And then when I got to the United States about 6 months later, my brain came online and I was able to do a lot of cool stuff. Then I'm just trying to give you some of my trauma history, as exciting as it was. So when I was a medical student, 3rd year, or fourth year. So I was in Puerto Rico and I was snorkeling with this buoys place, and it's kind of fun. And then the boat ran over me and sliced me up. So I had an out-of-body experience, which was another story altogether. So, and the guy just stopped and kept looking me bleed.
Really?
Yeah.
Wow.
So
Didn't offer to help or anything?
No, he was drunk out of his mind. So I crawled in the boat, put pressure on the bleeding points. I had enough medical training at that point.
Coming in handy on yourself.
Kind of helpful, yeah. And then medical intervention was something else altogether. They had to operate me a couple of times. They almost killed me a couple of times, whatever. And then I came home, and a year later, my mother took her life.
Ooh.
So that was
Sounds
a
like
lot
there's
of
some
entertainment.
backstory there. What was your relationship like with your mother? Or how was your parents' relationship? What was home like life?
Well, they had a funky relationship. Well, my father was highly traumatized. So he was very smart, very driven. But I think his parents were horrible people. They fought. The first memory that my father had was he was being dragged to divorce court when he was 2 years old. And then he was a flyer in World War II. Out of 10,000 flyers in his squadron, I think 100 made it home. So, I mean, severe trauma for that. Then he was he did the best he could. Again, he was very smart. He brought us to this country, and then but it was very traumatic for my mother because it was very hard to live in that. It was like always walking in eggshells. So I got into medical school. Then I was going to start surgical residency, which is very intense. Cook County was like the place to do surgical residency. And then, so she told me, if you leave, I'm going to die. I was like, and I said, you should get divorced. I said, no, I love him, blah, blah, blah. So, of course, 3 months later, under care of psychiatrist, she died. So she saw a psychiatrist and she killed herself like a day later. Poorly. It was kind of interesting. So I was in county. I was taking care of a lot of people who were heavy alcoholics, right? So I tried smoking, and it gave me so much spasm in my lungs. I was like, I can't smoke. Ugh. So I tried drinking, and I was doing pretty good drinking, pretty good.
And good success.
But then I checked my liver levels, my pancreas levels. My amylase started to climb, so it means I was frying out my pancreas. So I thought, nah, that's probably a bad idea, and I just stopped. And then my father was calling me every day saying it's the worst day of my life for like the next 3 years. So it was a lot. And that's why I left surgery, because of that.
Yeah. Do you feel like a lot of your upbringing and the trauma you experienced in your life is what has called you to really lean into serving people on their healing, people who are struggling with PTSD, which I know you have a thing with PTSD. So I want you to also explain a little bit about that, because
That's a can of worms.
you talk about how
the name?
it's not a disorder, but an injury, right?
Right. It's real. It's biologic. Yeah. Frankly, I was just trying to survive. The one thing that my father had, a lot of really cool fables or stories. So my favorite one he told me was like 2 frogs jumping around, and they end up inside this big jug of milk. Remember, you're way too young. But they used to transport milk in those big jugs, and they had a big open head in it. Anyway, so that they end up inside milk. So one of the frog goes, well, it's time for me to die. Goodbye, and thanks. The other one says, I'm going to be fighting for every second until I die. So he's fighting, he's swimming, he makes butter and jumps out and makes more
Oh,
frogs.
I love it.
So when I was drowning, literally in Mexico, I was thinking about which frog am I going to be? There's no way in hell I would be the one that just goes, oh, I'm so sorry, I can't do it. But as far as at no point did I really set out to try to change face of trauma. That was, I'll tell you how that came about. It was, again, a bizarre story. Like everything in my life seems to be weird. So in 2002, I think, something like that, I had a patient that came in and she had severe hot flashes. She came in, had neck pain. I burned some nerves on her neck, took away the neck pain. Yeah, I did my normal thing. Anyway, she said, that's great, thanks, my neck is fine, but I'm still having hot flashes. So I sent to my brother, who's really a smart internist. And he tried to treat her with usual hormones or whatever. She comes back, she says, nah, it didn't work. So my brother said, well, why don't you try this thing? You do stellate ganglion block for hand sweats, called CRPS, complex regional pain syndrome. I happen to be an expert in that. And the treatment for that is stellate. So he says, well, CRPS is the same thing as the whole body sweat. I said, it's not. He said, okay, why don't you try it? I said, nobody's done it. He said, why don't you try it? I was like, okay, I know how to do the procedure. So I did the procedure, took it away. No hot flashes. So she leaves for a year, comes back a year later. She says, can you do the block again? I said, what do you mean? She said, well, my hot flash was gone for a year. I was like, whoa, that's crazy.
Wow.
So I thought, all right, fine. So I guess it works. So I called up my brother. I said, send me 10 patients. We'll try them.
But at this point, you're thinking it's just because the hot flashes are being alleviated. That's why her transformation was so great
Definitely.
during that time.
Oh, no. Well, what happens with women, which thankfully you guys are young, but when they have hot flashes, a couple of things that happen. You can't sleep, right, because you sweat. And then, so one of my patients said, Her husband calls her a wet fish.
Oh,
it's like
sexy.
sleeping next to a flat fish. And she always freezes the house.
Oh, no.
They're always bitching about the women freezing the
Cold
house.
wet fish.
Cold wet fish. It's not good.
So
Alarm me
that's
depressed.
the irritable. So at this point, you're thinking she's just irritable because of the hot flashes. So when her symptoms,
Yeah,
are
because
leaving-
she said, I can't live like this.
I
I'm
see.
burning it from inside
Yeah.
out.
Yeah.
So it wasn't much of a choice because she was so nasty. I was like,
Yeah.
maybe if I take the hot flash, maybe it'll be decent. Well, it did work. Anyway, so we treat 10 patients. We did well. We published it. And then Chicago Tribune came by to do a story. And I thought, wow, this is great. We can help a lot of women, blah, blah, blah. It was 2005. I still have that paper hanging in my office. I think I showed it to you. So I read the first line. I knew I was in trouble because when it says, Bianca Kennedy, this beautiful breast cancer survivor, so desperate to get rid of hot flashes, she let Dr. Lipov plunge a 3-inch needle in her neck.
Oh, no. You needle
It
plunger.
went down. That's when I
You
became a needle plunger.
plunger,
Yes.
you.
I'm a needle plunger, yes. And then it went downhill from there.
Yeah.
So then they went to Northwestern, where I went to medical school. They go to the head of gynecology, or OB-GYN. What do you think? They go, oh, this is totally responsive. This is dangerous. Oh, my God.
You just get thrown under the bus.
Yeah. Then they went to Rush, where I did my pain fellowship. Oh, this is not how we trained them. This is terrible. Ta, 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 ta.
You're like, I'm just trying to
Yeah.
solve hot
And
flashes
they said,
for women.
yes, it works. They said, yes, it works in the paper. But he doesn't know how it works. So it's garbage. So I was a little angry, to put it mildly. You can ask my wife.
Now you have a challenge, I guess.
I was livid. It wasn't a challenge. I was livid. So I was because Bianca happened to be a great writer. So we're going to write a paper. We're going to write something back the paper. And I remember saying, I used to be into sayings. One of the sayings is, never argue with anybody who has ink by the barrel.
Ooh. Never heard that one before.
Yeah, it's a good one. So basically, don't fuck with press.
Right.
I was like, okay, so what can I do? My logic was, if I can explain how it worked, then I'm good. Publish it scientifically and do all of that stuff. Which I read about 3,500 various articles about stellate.
3,500. Wow.
A lot. This
So
is
at
when
night you're just sitting up, burning.
I'm just
the midnight
reading
oil.
because I was so angry. I was very angry, to put it mildly. Anyway, so I crossed one article from Finland where they were doing T2 clipping, which is basically you stick a tube in the chest, push the lung out of the way, and clip sympathetic nerves, fight and flight in the chest for hand sweats. And they found PTSD stuff. I was like, what? Crazy. Anyway, turns out, then I look at the anatomy, it turns out T2 ganglion, because stellate ganglion goes to the brain. So I called out my brother and I said, send me some patients with PTSD and I'll see if we can treat him. So he had a patient like that. So that guy was attacked and they did some horrible things to him during robbery. So 2 months later, he was on his way to the psych ward. So we did the injection. He didn't have to be admitted. So I published that. So then I was telling my wife and I said, hey, this is really cool. So she, being the subtle woman that she is, says, you're so full of shit. Nothing can work on everything. It works on pain. It works on hot flashes. Yeah. It works on PTSD. No way, it's not possible. So I wrote the article, somewhat to her, somewhat just to kind of put it all together. I called it Unified Theory of Stellate Ganglion Block 2009, and then it got easier. So the Tribune story is kind of interesting. So then, 10 years later, the Tribune geniuses write a paper that stellate ganglion block is so effective for hot flashes. They got $4 million grant from NIH.
Oh, how times have
You do that.
changed since the needle plunger days.
And they gave me no credit at all for it. No apology, no nothing.
Wow.
Thank you so much.
What's so interesting about everything that you described, though, about how SGB was effective for pain, CRPS, how was it effective or how was impactful for hot flashes and hormonal issues, for PTSD, just goes to show how the nervous system is connected to so many different chronic health conditions.
Absolutely.
And I know you and I have even connected about the use of SGB blocks for people who have Crohn's, ulcerative colitis,
Right.
or a lot of gut dysfunction. And I know in my practice, Rachel Shear Nutrition, we see a ton of people who have serious gut issues that they're
Right.
struggling with.
IBS.
Yeah, IBS. And we do a lot of the treatments on healing their gut. But that last piece that we really try to work with clients on is the nervous system. And
Right.
I think what's really powerful is when we can approach things from a top to bottom approach, but then also approach it from healing the gut. This is where I think we can see the most profound
So
results.
if you can relax the gut, well, so it's interesting. So you're talking about ulcerative colitis. So there was a study out of China where they did stellate. Half the people had stellate, the one who didn't. All of those guys all the patients had activated ulcerative colitis. So they measured symptoms. They also measured interleukin-6, which just shows how much inflammation there's going on. So the ones who had the stellate reduced the interleukin-6. So it shows it calms the immune system down. Actually, I wrote a paper on that because I wrote a paper accompanying their paper because it's like they really didn't know why it happened, which is really interesting. You're right. So potentially you can, so the first use of stellate was 1926. It was for asthma. It's interesting. If you think about it.
Interesting.
Asthma is an allergic reaction.
but there is the immune system component.
Oh, yeah, exactly. So there is a direct connection from stellate, so sympathetic here, to thymus, which controls T cells, bone marrow, which is B cells, and the spleen.
What
So-
about autoimmune conditions? Because we have seen over the last decade, autoimmune conditions, specifically around women, continue to rise. How could SGB blocks be effective for people who have autoimmunity?
Well, I haven't really studied it directly. Ulcerative colitis is a form of autoimmune disease. So we know that. It's been used for a couple other autoimmune things, but it's like sporadic. Nobody truly studied it for that. I had a patient, which I never really wrote up. So he had seasonal allergies 50 years. We did block for pain, hand pain. He called me up. I had no allergies for 2 years after one block. Weird, right? So potentially it would work. The other part is, why does it happen in women? So women have the difference in men and women. There are a couple of relevant here. One is their immune system is much more active than the guys. So if you look at thyroid dysfunction in women, twice as likely.
And their sympathetic nervous system is much more sensitive.
It's much more active. So there are two examples of that. Exactly. I think you and I have talked about it. You're stealing my thunder.
No, I'm not. I'm not.
Steal his thunder.
So if you look what happens as women age, estrogen level goes down, right? So estrogen level goes down, blood pressure goes up. So sympathetic system causes the blood pressure. So if you give them estrogen back, their blood pressure goes down. And also, if you have a woman that goes through the same trauma as the man, the chance of PTSD rate is twice as high in women.
Really?
So to me, the reason God made estrogen, it's a natural way to reduce sympathetic system that's overacting in women. Is that an odd perspective?
Very fascinating.
I feel like there could be a really profound effect on autoimmune conditions because when we see people operating in a chronic sympathetic state, we see the immune system is suppressed and we see the immune system starts to become impacted. Maybe it's increased or it dysregulates.
Actually, the term I like to use is dysregulated.
Dysregulated
It could
immune
be up,
system.
down, sideways, all type of things. Yeah.
So whether it's chronic stress, right, we can see this through studies of people in pre-med who are studying for exams and what happens with their immune system and how that becomes dysregulated.
Oh, yeah.
And we also
Absolutely.
see this with people who experience a lot of trauma. So it makes sense that if we can calm the nervous system, we can then, in a lot of ways, calm the dysregulated immune system, which is really the core of what we're seeing with a lot of people with autoimmune conditions. So it's really
No question.
fascinating.
Yeah. Well, what I found fascinating is that people have known that for a long time, right? being stressed is not good for you. I mean, it's obvious. But just the mere fact we can measure interleukin-6 and actually see it drop. And then there are the way, to me, it's one of the, I mean, I'm a geek, no question. But the way they measure direct connection of sympathetic systems, what you do is, in a rat model, you use rabies virus, which are tagged with whatever, tagged with something. You inject it in the ganglion, and then you see where it all goes. And then you could see a direct connection to the amygdala, which controls anxiety and PTSD, thymus, bone marrow. So we know there are direct connections. So it's so all pervasive. So the reason my wife was right, like it's hard to believe, but the reason I was right was because sympathetic system is everywhere, right? It starts, the idea is when you hit the panic button, you want every part of the body to be involved in this.
I mean, it just makes me think about something, I mean, all of us have talked a lot about and are even placing a significant focus on in some of the work we're doing, is the fact that when you have this body, this interconnected system, and then you've got a conventional medical system that treats it in fragments. And it's incredible as I mean, listening to both of you talk back and forth, it's all of it is working together in harmony, for better or for worse. And so the need for treatment that really focuses on the entire body is significant. And I'm feeling like we're just now starting to really understand the effects of the nervous system. I mean, we've both worked with a lot of warriors, especially in special forces, and have gone to combat zones. And we're seeing that the nervous system component is something we are just it's just now entering the conversation in terms of what PTSD is and the treatment.
No, I agree. You're right. What's interesting, so when I looked at all this stuff about studying sympathetic nervous system, I would say I know a lot about that. So sympathetic nervous system was discovered like in late 1800s. And then there was a lot of work till 1930s. And then it's like, nah, we're done. What do you mean you're done? What do you mean you're done? It's a very important system. The point is, most people don't really think about it in great detail because it's hard to modulate it. However, stellate ganglion block kind of now is dragged out. I mean, I was very fortunate to start it for PTSD as well as hot flashes. But there is a big use of it. For example, now somebody has cardiac storm where the heart just goes crazy. So you can stop that. And also you can reduce the size of infarct after somebody has a stroke. So people are starting to do it more and more. They're waking up that sympathetic system is a big part, right? So because you can do amazing things, but if the gut is always in spasm, right, it feels like it's a knot. It's hard to fix the biome if it doesn't have a normal peristalsis. You're constipated, all those things. So, and not everybody needs a stellate, for sure. But just respecting it and knowing that doing the deep breathing, activating parasympathetic system, you can calm down the sympathetic system. That may be all it takes. But realizing we need to start the journey there.
Can you talk a little bit about how we have really labeled PTSD, which, right, post-traumatic stress disorder, as a disorder?
Right.
And how it really shouldn't be labeled as a disorder and it's really an injury.
Yeah, it's another little things I've been fighting for a few years now. So the term PTSD was introduced in 1980 with DSM-3.
Will you explain what the DSM is?
So DSM. So basically, in the 50s, psychiatrists wanted to get into diagnostic game because it's kind of. I mean, psychiatry is a tough. I think it's not an easy task because you don't have a simple X-ray. You can see broken legs. So diagnostic statistical manual came out in 1950s. It was a nice thin book. So being homosexual was a mental disorder in that book. It was not well received by population at large. And then they took it out, I think, in DSM-2.
Is it true that hysteria for women was also considered a mental illness? Like if a woman was sexually active or if she gave her husband a little pushback, he, often labeled as hysterical. I've heard things to this tune. Is this true or lore?
Yeah, I think so. Well, hysteria is a term that Freud introduced, actually. That was not a DSM term. Hyster is another name for uterus. But it's as a yard doc, I've seen plenty hysterical men. So I don't know if they have uteri, but I don't know. Something was
Does
going
not
on.
discriminate.
No, and the treatment of hysteria, one of my favorite ones. I was lecturing in Harvard about some spine procedures, and I picked up a book. It was called History of Hysteria. So you know the original treatment for hysteria in the late 80s,
What?
1800s? It was fumigation of the uterus.
Oh,
Let me tell you how that works.
I don't want to be fumigated.
Yeah, I hope not. So I always had this idea that you're riding around.
No, I don't want to be fumigated.
Anyway, so the way you did it is you have a long skirt, you put in stirrups, the legs in stirrups in the woman, put a bin of heavy metal on heat. So all that heavy metal and poisons go up in the equipment.
Now I have PTSD.
Yeah. Just from the visual.
Visual, huh?
This is like some
Yeah.
medieval torture.
That was 1800s.
Wow.
So, yeah. So hysteria is not a term people use now. Anyway, back to the show. Back to the PTSD. So PTSD term, the disorder is basically the way they is described as you need to have an experience outside normal human experience. That's the definition. So that right there was, to me, bad, or very bad, because a lot of time people come in, especially women, they go, I've never been to war. I cannot have PTSD. Well, were you raped? Yeah. Okay, that's probably bad. Or were you attacked? Yes. Or something else happened. The point is you can have multiple trauma like that. I also saw a young man who was 18. He was walking through school. Somebody touched him on the shoulder and he got scared. He got PTSD from one touch on the shoulder.
Wow. So it differs a lot from person to person.
It depends how sensitive you are to trauma or being shocked or whatever.
One thing that I love that I heard you say to my team is that trauma is not defined by the event, but it's actually defined by how your nervous system responds.
True.
And that injury that takes place within the nervous system. Because I think often people will sort of trauma flex, or they'll say, well, I didn't have anything like that happen in my life. And they'll compare events when in reality, like, who are we to say what is traumatic for one person
Exactly
to
right.
the other person? But we really need to look at how is the body responding?
Well, how's the body responding? And you can have an event, and then if you can't sleep, you're depressed, and you become a recluse. The event may have been minor to somebody else. It was major to you. Plus, you really don't know anything about the genetics of that person. You don't know, maybe their parents were completely abused, or they were refugees on a boat and half of them had to eat the other half. I don't know. You don't know. You don't know what you're starting with. But that's such a pernicious, problematic statement that needs to be outside normal experience. I think it's just crazy, in my opinion. Anyway, so one of the people who actually defined the term PTSD is Frank Hugbert. He came up with the term Stockholm Syndrome. So he used to be a number 2 man in NIMH, National Institute of Mental Health. And he spent a lot of time working with CIA and all type of amazing work. He believed the name needs to be changed from PTSD to PTSI, post-traumatic stress injury. So he got hooked up together with Pete Shirelli, Pete Shirelli, general. He's a 4-star general, not a doctor. He was placed in charge of suicide prevention by the Army. So in 2013, Pete Shirelli and Dr. Hugbert went to DSM committee, which defines the terms, and they said, you need to change it because it causes stigma. And you know what the response was? No, it doesn't. Goodbye. Look. Anyway, so Frank and I connected, and he passed this hot potato to me. So I'm the lead of that now. So to that, I did a study in 2023, and we published that. We asked about 3,000 people, if we changed the name PTSD to PTSI, would it be helpful? I knew that was true in the military people, but like we asked regular people. And majority of them said, yes, it could be helpful because the stigma will go away. It's not a mental condition, it's a physical condition that can be diagnosed and treated. So when people tell me, I have invisible trauma, my answer is you have invisible trauma if you have the wrong scanner. If you have an advanced scanner like a PET scan, MAG scan, whatever, you can actually see it. That was one of the articles that Dr. Alkai wrote, which is really cool. Anyway, so what's interesting, then I start to look in detail the name changes by DSM. So a number of names have been changed. So one of them, I think the easiest example to kind of see where they're at is called learning disability, used to be called. Now it's called learning differences. The reason it was changed because a lot of parents petitioned and said it's stigmatizing and traumatizing to our children, which is true. But to me, you can use the same logic in PTSD. So I wrote so nowadays you can change the name tomorrow if they want to change it, if you can convince them. It's called DSM-5-TR. In order to do that, there's one requirement. If you can demonstrate that the current terminology is traumatizing, then we'll change the name. So I wrote in this big, extensive letter. I put all the sciencey stuff in, my study, whatever. They lost it 4 times. Anyway, they found it. 3 months later, they said, not enough data. Goodbye. Thank you very much.
That was it. Just not enough data.
Goodbye.
Do you think there's an ulterior motive going on here? Because
my
brain immediately thinks like, well,
no, there is, and DSM has a checkered history. They were shown to get like $15 million from the industry, which they have no business getting, like from pharmaceuticals. And the whole disorder thing, it's interesting. So that brings up Planck. It's called Planck effect. So Planck was a great physicist, German physicist, 1912. I think he got Nobel Prize for Planck constant. So his Planck effect is basically, he said, science move ahead at funerals. So people who are in charge of the old ideas need to die off before new ideas can come around. So I have not given up on this principle yet. I'm still working toward it, but it has been surprisingly difficult.
Yeah. It's really interesting to see how many diagnoses there are out there in the medical space that are really based off of different symptom clusters. And when we give somebody the label of PTSD or we say that they have a disorder, what we see happen is people actually take on that label and they say, there's something wrong with me. I'm broken. I have a disorder. And there's almost a loss of hope where people stop looking for ways to heal and to get better. And they just say, this is something I have to live with. And it's something that I have to now manage the symptoms with. You know what
I call it PTSD lifestyle.
Yeah, PTSD lifestyle. And
then you do trauma flexing.
Yeah, trauma flexing. But by shifting it to an injury, I think why that's really powerful is because now we're shifting the conversation to this is an injury. And therefore, we can heal an injury. So it allows for hope to actually be instilled in the people who are experiencing trauma in their life.
Well, the other thing is, it's not, I think it's kind of important to keep in mind is, it's not just we decide to change the name. So keep in mind, 1980 is when PTSD term came up, right? So science moved a little bit ahead since then. So now we have scanners. So now you can scan and say, hey, this person has it, this one doesn't have it. The point is we know it's biologic.
You can see PTSD,
you can actually see PTSD or
on
PTSI
the brain
on
scan.
the scan. So it's real biology.
Wow.
We're just saying call it what it is based on...
It's physical.
Right. Now,
Wow.
before, when somebody has a broken leg, before X-ray, unless it was a bone sticking out, you don't know. But when the X-ray came by, it's like, what's a broken leg? Right? It's not a broken leg disorder. It's a broken leg. Let's diagnose, let's treat it. And the other part is, especially women, in my experience, self-blame. I haven't done this right, I didn't do this right, or whatever. But instead of the way I tell people is like, first of all, trauma is not a competition. You don't want to, so actually it came out an interesting story. So I was giving a lecture in, it was a Pritzker Military Museum. 2 years ago. And I said, the name needs to be changed, blah, 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 all of that I've talked about. So he gets up, this guy who's about 75 years old, he said, I was in Vietnam. I said, well, thank you for your service, blah, blah, blah. He said, I think military trauma is very different than, like rape. I said, well, let me see if I understand what you're telling me. Are you telling me the trauma you went through, and I'm sure it was traumatic, I'm not taking anything from you, is different than a woman that's chained to a sink and raped for 10 years? Are you saying your trauma is worse? Is that what you're telling me? Is that the competition you really want to get into? It did not end well.
It's a thing now, though. We see trauma flexing. It's really interesting to start to notice that a lot more. And I think people have become a lot more aware of trauma and how that impacts their life and their health. But I know something that Lauren and I talk about, and that's going to also be in the program that all of us are working on, is how awareness without ownership and action only perpetuates the problem. It makes it worse.
Yeah, the other part is, I think the question is, when you have a psychiatric disorder, and when people talk about the trauma, and sometimes, especially women, I mean, I've seen women do it more than men, but I've seen men do it as well. But some of them would like to have, they'd like to shock you. It's like, when people start to do that to me, I was going, something, I don't care. I don't care about your trauma. Needle goes in the same spot. I do not care. Were you raped 1,000 times? Somebody was attacked. This is a battle. I don't care. You don't have to tell me. So I really don't know why they do it, but it's self-traumatizing. And a lot of times, there was a kind of interesting story. So, you're old when you have like stories for everything. There was a documentary, it was called The Shot. They did about me and 3 of my patients. So one of them was this unfortunate man. So he was in a convoy in Iraq. Of course, all of his friends were killed, all of this. So he goes in the VA, and you could see that. It's a 12-minute documentary. And goes to the VA and talks to the therapist about all the experiences. She starts crying and like curls up in the ball. So he goes, I broke the therapist. So a lot of people can't take that. But if you can do the stellar ganglion block and reduce the angst, then you can process it. But trying to shock somebody with trauma, like I've had people try to do it, and they can't do anything to me. I've had plenty of my own trauma, and I've had enough defenses. But sometimes people are competitive about trauma. It's like, I'll see your trauma, I'll raise you 2 traumas. Like, what's the difference?
Well, and I think a lot of it has to do with that sometimes it can become part of someone's identity.
It is. It's a lifestyle.
I think, and it goes back to the bigger conversation, is that if you're told, and there's these messages that this is unfixable, that you're going to spend your life managing a lifestyle of trauma, and that the only options for you are to either medicate or to do talk therapy, which those have a time and place, but they don't offer a real solution for it actually being changed. And so people really start to sit with and think, this is part of who I am now. And so when you have that awareness without action, it just lends itself towards a sense of hopelessness. And then I think, if you have a broken arm, it doesn't become part of your identity in the same way that having a terminal, chronic, uncurable illness would.
So let me give you 2 thoughts about that. Number 1, if you look at standard therapy efficacy, which is psychotherapy and pharmaceuticals, you're looking at 35%, maybe 40% success rate, with placebo being 30%. And it takes a couple of months to a year or ever, right? So, and you go see a doctor and they keep saying, that's all we got. So that's propagated by the medical system. It's not just the patient. That's a separate issue altogether. There is serious money involved, right? So, so that leads me to another discussion. So I was talking to this, he was a colonel from Joint Chief of Staff. He came by and see me in 2010. And he said, you have a problem with your program. I said, you don't like the results? I said, it works. You've taken care of some of my guys. It works. You're asking people who are in charge to be in charge of second best thing. So you're fighting prestige and money. So, that's just the reality. But what I'm hoping that people can take away from the program, right? So to me, you can listen to the program. It's kind of interesting anecdotes. But the question is, what is the impact? At the end of the day, what is the impact? So to me, number one, PTSD is a real condition that is treatable. That can give you hope, and I could truly save lives. Just that simple concept.
The hope will save lives.
Yeah, exactly. But then also saying that I've done 20 years of psychotherapy and pharmaceuticals and it failed. Okay.
Not to mention all the side
you
effects.
haven't had the right treatment yet. That's all it is. There are other treatments. There's stellate ganglion block. There is TMS, which is transmagnetic stimulation. There is ketamine. There are other modalities you should try. But, if it doesn't work, okay, so you did the wrong thing. So, how many times did it take to make a light bulb, right? Edison, right? You know what they ask him? It's like, how are you able to persist when there's been 1,000 failures? Did you hear that story?
Oh, yeah.
He said, I found out 999 ways not to do it. Okay. So he did it. And we have light.
Thank God.
Dr. Lipov, you've unlocked a truly revolutionary treatment for trauma and PTSD. And I think what is so incredible about even what we're all working on together is now when we can combine things like SGB blocks, ketamine, working on the nervous system and the root of where a lot of these injuries manifest with people who have trauma and PTSD, combine that with things like taking a functional medicine approach, working on the gut, the hormone regulation, we can really see some powerful shifts take place. A question that I have for you, if there were three keys that people could really, whether it shift their awareness around trauma and PTSD, or three things that they could start doing today to work on healing from their trauma and PTSD, what would you say those would be?
Well, I always like to have measurements. So I'm kind of by measurements. So if you look at what hello. Thank you very much. You think it's an important question? I agree
The extra member of the unlocked cast.
It's comic relief right here. But like, for example, Oura Ring or a Fitbit. So the cool thing about those, they'll tell you how well you sleep. So if you don't have good sleep, that's a big problem. If you're using alcohol to sleep, you're not doing yourself any favors because you're not sleeping in the deep phase. So number one, find out about your sleep. Plus, a lot of people know you don't need all those fancy gadgets to know you're not sleeping well. So number one, try to get some sleep. How can you do it? So I would definitely not yet. Benzodiazepines, I think, are evil.
Yeah.
I think those are bad. Besides being addictive, long-term use shrinks your brain. It's kind of bad. You want to have as much brain as you can. Alcohol works the same receptors. So you don't want that. But meditation, I think, is great. And my favorite meditation is Yoga Nidra body scan.
What's that?
Basically, it's like you're lying there, body need Yoga Nidra. Basically lying down and you're listening to nice music and somebody tells you what you're doing. But the body scan is like you start, I'm relaxing my left toe, my left ankle,
it's
my
like,
left knee.
Yeah, the body scan type meditations.
Exactly.
Yeah.
So I think that'd be number one. Number two, exercise. Not crazy exercise. Some people exercise like nutballs and break their ankles, whatever. It's like, no, within reason. Go for a walk. What that does is produce endorphins. You can sleep better. Don't drink coffee right before you go to bed. Right?
Matcha.
That's stupid. Matcha, you probably, I think you can do that. You're the expert.
Not
I would
right
have to
before
ask
bed.
you on
Not
that.
right before bed. But
Yeah, it's probably not good.
Yeah.
Put away the devices. Devices are horrible. Blue light turns off your melatonin production. If you want to take something to go to sleep, take melatonin. That's natural sleep stuff.
L-theanine. I love L-theanine for sleep.
Me too.
There you go. I don't know what that is, but I believe you. I know melatonin. And the other part is don't watch movies and all that kind of before you go to bed. And then after you eat, go for at least 10, 20-minute walk. It's been shown to improve sleep, reduce obesity, all of that stuff. Also, turn off the news. Turn off all the being, and it's like every moment they wanted you to know what
All
this
the
happened,
negativity too and fear.
Exactly. And it sells, but they're not doing you any favor. What are you going to do? If the only time you have an announcement that there's an earthquake or a hurricane, you have to do something about it.
And your poor nervous system, like
Yeah, it's like-
hypervigilance.
Yeah, exactly. I analyze the news for half an hour a day.
Interesting.
I just don't let all the bing-a-ling-a-ding going all the
How
time.
many happy things do they share on the news about puppies or I'm kidding. Not always like scary things, right?
You have to work pretty hard to find positive news.
Yeah.
Because that doesn't really sell, except it's cute puppies. Eventually,
course.
there are so many.
Fear spreads much more.
Oh, of course. That's why. Yeah, exactly. It makes you sell more. It's like, oh yeah, read more about it. It's like, but you see a picture of a dog being with a duck being made. Oh, that's
I'd
great.
watch that.
I like that news.
I know.
that
But my
news.
point is, you see my point.
I know.
My
Of
point
course.
is,
Yeah.
I would do that.
I get your point.
And the other part, you have to get toxic people out of your life. So every time you
that's
come in
huge.
and see somebody, or it set borders, right? Like I had to go see my father. Everybody abandoned him, which wasn't right. But like he said, why are you coming? You're always drunk. It's like I would literally have a couple of drinks before I would see
you're
my
like
father.
pre-gaming
I
to
was
see
pre-gaming.
Dad.
I was like, oh, what up?
That's how
How
you know
doing?
Trauma.
I'm not
Should we all
suggesting-
remember this for family
I'm not
gatherings?
suggesting doing that, kind of. But the point is, if you realize you're going to be either get rid of that person or set limits. Say, I'm going to see you this many times. But like, if you think about it, and I'm not blaming my father at all, but every day he called me for 3 years, that was traumatizing to me, right?
You have to take care of your environment.
Yeah, so what I've learned is like, no. And when people ask me stuff I don't want to do, it's no is an amazing, powerful statement.
Learning the no button. Yeah, the no button.
No button.
Having the no button.
Yeah, a no button, that's cute, yeah. But I tell people, it's like, no, I'm not going to do it. It's like, what do you mean? It's like, I am not going to do it. Which part of no are you not getting? No. So I've learned to be very good at defining things.
That's
and I
good
think
boundaries.
it's a good thing. And as long as there's life, there is hope, right? Even people with terminal cancers, a lot of times can have a high quality of life. And, there's always, and, the way our advertising system works, it's pretty sad. Also, it depends what you eat, right? Ultra-processed foods really is bad for you. And they can rev you up like crazy. And then people go, like, I can't sleep. How many Red Bulls did you have? 5?
I
I
wonder
cannot
what's happening.
figure out what's going on. I think you have sleep disorder. Can you knock off the bull, like,
We got a
Red
pill
Bull?
for that now.
Yeah. Oh, you have. Yeah, and then you
It
have to
makes
take
you tired, so you
yeah.
need an extra Red Bull.
Exactly. Yeah, exactly. What was that? Oh my God, there was a song about one pill makes me high, one makes me go,
Yeah.
one makes me feel nothing at all.
Exactly. Yeah.
Did I answer your question?
Yeah, you did. I think everything you shared, working on environment between doing meditation, getting a good night's sleep. These are all really powerful things, paying attention to what we're putting into our mind every single day. And then for those people who are really, really struggling, so maybe you're listening to this and you're thinking, I have PTSD and this has been wreaking havoc on my life. I can't sleep at night. It's impacting my relationships. It's impacting my well-being. Doing a treatment like the SGB can be truly life-changing for so many people. And especially when we can combine that with the power of functional medicine. And I know that's something we're all super excited about what we're working on with the new program that we're building. We're excited to share more about that very soon. But where can people learn more about you and everything you're up to?
Well, thank you. So I'm a chief medical officer for Stella Center. So if you want to be treated by me or my associates, we have 24 sites in the United States, and we have 3 in Australia and 1 in Israel. If you're interested in the sciencey part, stuff I've written and some other stuff, you can go on my website, which is dreugenelipov.com. So all my articles are there, and all the sciencey stuff is there.
You're also our chief medical director.
That's
Don't
right.
forget about that
Indeed.
at Rachel
Well, I
Shear
don't know what the
Nutrition.
website is yet.
Yeah, rachelshear.com. But we'll have another separate one when the new bio program comes out, which is
soon.
going to
More
be
on that
an
soon.
focus on
The cool thing is gonna be
psychophysiology
integration, right?
is
So
the
you're gonna
integration
integrate
of all of us.
exactly, which is
Super powerful.
it's
I'm so
amazing.
excited for this. It's going to be life-changing because already what you're doing is life-changing. We know the power of functional medicine and
Well, what you're
being
doing
able
also
to
is
combine
life-changing.
all of this.
What we're doing.
But what
Exactly.
we're doing. So I'm excited. We'll have to do another episode when that launches and tell everybody what
can't
we've been
wait.
up to. Thank you.
Right. Thanks for being
Thanks,
on
guys.
today.
Thank you for having me.
And this has been an episode of Unlocked. Until next time.
Same luck and peace.